Good morning. I'm Dr. George Lundberg, Editor-in-Chief of MedGenMed. In the old days, we used to call it BMR, basal metabolic rate. Now we call it resting metabolic rate. Dr. Val Jones, the founding editor of MedGenMed's e-section on clinical nutrition and obesity, will tell us this morning why the resting metabolic rate might be so important in the control of body weight as to constitute a new vital sign. Dr. Jones.
As the diabesity epidemic rages on, 95% of all diets fail, and 2/3 of Americans are either overweight or obese. All kinds of reasons have been cited for the rise of obesity, yet there is a critical component of the weight management equation that has not received much attention: resting metabolic rate, or RMR. Many dieters assume that they have slow metabolisms and must starve themselves to lose any weight at all. In fact, the opposite is true in many cases. Dieters can have fairly hefty caloric needs, and undercutting themselves by more than 500 calories per day will cause undue hunger and drastically decrease diet adherence. In an ongoing study of obese New Yorkers, resting metabolic rates among women of equal ages and body mass indexes varied by as much as 700 calories a day, and men by as much as 1,000 calories a day. This suggests very strongly that one diet does not fit all. Moreover, attempts to predict a patient's metabolic rate with the Harris-Benedict equation, among others, often yields inaccurate results. Resting metabolic rate measurement is easier than ever, as handheld devices have replaced the cumbersome metabolic carts of exercise physiology labs. Indirect calorimeters measure oxygen consumption to determine RMR by means of a 5 to 10 minute breath test. The cost to consumer is perhaps $20 a test, and since RMR represents about 75 to 80% of daily caloric needs, it's fairly easy to calculate an appropriate calorie target for weight loss, taking into account general activity levels. I think that RMR should be part of regular screening performed by primary care physicians and healthcare professionals involved in assisting patients with weight loss. Dieting without an individualized caloric goal is like driving a car without a steering wheel. Maybe this is part of the reason why America has so many nutritional casualties. That's my opinion, and I'd like to hear yours. I'm Dr. Val Jones, editor of MedGenMed's e-section on clinical nutrition and obesity.